The Queensland Health Payroll System is an extremely complex payroll system that was responsible for maintaining the hours that were worked by employees, calculating wages, tax deduction, and delivering checks for over 85,000 staff that worked for the government's healthcare services such as doctors and nurses. The system was built by 4 different organisations, these being IBM, CorpTech, SAP and Workbrain. In 2006, the Queensland Government started working on the payroll system with their internal company named CorpTech. Unqualified business personnel were tasked with gathering vital user requirements for the system in less than 2 weeks. This was one of the first of many errors that occurred during the development of the system. The system was expected to be completed by 2008, with a total cost of $6 million. Over the next year, CorpTech made little progress with the system, so IBM was introduced to help CorpTech build the system in late 2007. However, by October 2008, IBM hadn't met any of the contractual agreements. The Queensland Government, desperate at this point, invested more tax dollars into the system and allowed IBM to continue to build the system. The system was delayed numerous times, with some features being entirely scrapped and the system failing initial user testing, with over 300 major errors being found in the system. Finally, it went live on March 2010, initially replacing the prior system with the new malfunctioning system. From the first pay date, thousands of Queensland health workers were left underpaid, overpaid, or not paid at all. Workers who were overpaid were accused of fraud. This situation went on for months, with the Queensland Government hiring thousands of workers to manually process payments on a weekly basis, which quadrupled the cost of the system every month. Societal backlash was large, with the work unions such as Queensland Nurses Union of Employees holding large protests and media outlets featuring the story on the front page for weeks. The system ultimately cost taxpayers over $1.2 billion to repair. Many lessons were learnt from this case study, such as the importance of system analysis in developing a system, creating functional user requirements, ensuring open and successful communication between team members, choosing a parallel method of delivery, and lastly, ensuring user testing is passed before giving the go-ahead for the system to go live.